Good afternoon. Happy Easter Monday. I start off today with just mentioning globally there's 1.86 million cases of COVID-19 and approximately 115,000 deaths. Again, it's just a reminder that this is impacting not just Prince Edward Island in terms of what we're doing, but really every part of the world. In Canada, there have been over 24,000 cases of COVID-19 and over 700 deaths. Our case fatality rate in the country, 2.9%, which is actually a little bit less than the overall global fatality rate. Our hospitalization rate with the cases in the country is about 18% of all those of our cases, and 28% of those who are hospitalized end up in intensive care. In P.E.I, I'm happy to tell you that there are no new positive cases to announce, but we have also received 175 negative tests back over the weekend, which is also good news. 23 of the 25 cases of P.E.I are considered recovered. We've done over 1,900 tests, and that number of tests per population is actually just a bit above the national average. And I think this is really reinforcing that what we are doing is making a difference, but we need to keep going. And it's a reminder to me how different this could look if we even just have one outbreak resulting in a number of hospitalizations and deaths. This really reinforces to me that all islanders need to work together while we stay apart for this to work and continue to work effectively. COVID-19 is affecting such a range of people across the globe. Our vulnerable populations certainly are a major concern, but many are being affected. And we should continue to take this seriously for ourselves, for our friends and family, and for every islander. I've had a number of questions over the last couple of days about the ferry service between Prince Edward Island and Nova Scotia, which is set to begin on May the 1st. But I am sure that this ferry season will not look like other ferry seasons. And similar to our Confederation Bridge and airport, there will be screening at Northumberland ferries. And we'll be discussing with highway safety as well as public health officials about that screening process in terms of essential versus non-essential, as well as health screening and self-isolation plans. I have not done so yet, but I look forward to having a discussion with Northumberland Ferries Limited in the days ahead so that we can continue to plan, and we'll have more information for islanders as we go forward. And although the majority of islanders and the large majority of islanders are taking this very seriously and following public health measures, and we're so happy that people are doing so, we are still seeing some examples of those who are not listening. And we appreciate certainly not only how well people are doing, but we appreciate the concerns that are being called into us. We have had over 200 calls into our line, resulting in over 100 door knocks or visits to people's homes or dwellings, resulting in a large number of verbal and written warnings, police referrals, and 4 charges have been laid. We've also received a lot of feedback on the decision that was taken in conjunction with environment to delay the recreational fishing season. And the decisions are not taken lightly, and when we make these decisions, our primary concern is for the health and safety of islanders. And we're watching closely what is happening around the world, across the country, to try to make sure we keep our population as safe as possible. And we are regularly reviewing not only the decision around recreational fishing in our province, and we certainly will happily reconsider a delayed start date when it is safe to do so. I think it is too early to make that decision today, and because I do not believe we are comfortable saying that this is over yet when we're in the middle of a worldwide pandemic. We're all facing challenges at this time. People are unable to work, children who are not at school and have not seen their friends, islanders who cannot see their loved ones. So for these reasons, and many more, including the recreational fishing season, we hope that we can make announcements and give direction about when we can make changes about some of those start dates. And I think that leads into my next comment about it's difficult to put any kind of timeline on these measures that we've put in place for many of these things that we're doing. However, we do know that the length of time it will take is heavily influenced by our adherence to these public health measures and what happens, of course, to the virus and the pandemic around the world and in this country. If we are following public health measures, self-isolating after travel, staying home as much as possible, practicing physical distancing when we're out, it will make a difference. We are already seeing that difference that it can make here in this country and in this province. And so let's keep doing that. Thank you. Bonjour. À travers le pays, il y a plus de 700 morts et 24 000 cas de COVID-19. Et encore aujourd'hui, je suis contente de partager avec vous qu'il n'y a pas de nouveaux cas ici à l'île du Prince-Édouard. Nous avons confirmation qu'il y a 175 cas négatifs et on voit que les actions que nous prenons font une différence et nous devons continuer. Ce n'est pas terminé notre combat contre le COVID-19 et ça sera encore un bout de temps avant de retourner à la norme. L'impact de COVID-19 est global. On s'inquiète pour les gens vulnérables, mais n'oublions pas que ça touche tout le monde. On doit continuer de prendre ça au sérieux pour nous-mêmes, pour nos proches et tous les insulaires. On a des questions à propos du traversier entre l'île et la Nouvelle-Écosse. Et ce cédulé a commencé le 1er mai. Je voudrais clarifier que le service de traversier cette année sera différent. Et ceux qui arrivent à l'île seront examinés, vont faire la même sorte de choses qu'au pont de la Confédération. Ils vont être demandés des questions à propos si c'est essentiel que vous venez à l'île du Prince-Édouard et aussi les questions à propos de votre santé et ton plan d'auto-isoler. La grande majorité des insulaires prennent le COVID-19 et les actions nécessaires au sérieux, mais il y a toujours des individus qui se comportent autrement. On a maintenant plus de 200 complaints à notre bureau et plusieurs avec l'enforcement des actions verbales et écrites et puis les charges avec l'enforcement, il y en a avec 4. On a reçu beaucoup de commentaires aussi sur la décision de la pêche de loisirs. Et chaque décision que nous prenons a à l'esprit de la santé et sécurité des insulaires. Et cette décision était en fait avec le département de l'environnement. Nous comprenons la tradition de la pêche de loisirs et nous sommes en train de suivre la situation d'après. Je pense que c'est encore trop tôt pour changer la décision, mais si le cas se présente que nous pourrions avancer la date, que c'est sécuritaire pour tout le monde, on va vous en faire part pour la pêche de loisirs, mais plein d'autres choses aussi. C'est simplement trop tôt et nous devons continuer les actions nécessaires, malgré comment difficiles qu'elles sont. Et ça continue de cette langage avec c'est difficile de prévoir quand est-ce que ces mesures seront réduites. Mais ce que nous savons, c'est que le temps qu'elles vont durer sont directement reliés avec notre comportement d'aujourd'hui. Si on fait bien notre job aujourd'hui, de s'isoler après les voyages hors province, de respecter la distance physique quand nous devons sortir pour les essentiels, ça va faire toute la différence. On voit ça à travers le monde et ici dans notre province. Continuons, on est capable. Merci.
Thank you once again, Dr. Morrison, and good afternoon, everyone. I want to say thank you on behalf of the health system to all islanders who are staying home. What you're doing is making a difference and is stopping the spread of this virus. While we plan and prepare for a worst-case scenario, we are hopeful that by following the advice and orders set forth by Dr. Morrison and the public health measures, we can flatten the curve, and we have been preventing the further spread of this virus on P.E.I. and avoid high numbers of COVID-19 cases. We continue to offer the fever clinics and cough clinics, and anyone who has symptoms of cold or flu is able to access these clinics through 811 and or your family doctor or nurse practitioner. On Sunday, we had 57 patients at our Charlottetown clinic and 19 at our Summerside clinic. And we remind everyone to please call ahead as we look forward to this week with offering our essential services throughout the health system. Call ahead for your appointments to make sure they are still happening, and stay home and stay safe and continue these measures so we can keep this disease at bay. Thank you.
So happy to take some questions.
Brian Higgins, CBC.
Yes, good afternoon, Dr. Morrison. You mentioned that you hope to be able to make announcements about changing start dates for specifically what did you say? And can you give us more detail about specifically what?
I think I wasn't really speaking about so many specifics as just in general when we've talked about here, and I mentioned it the other day as well, that as we move through this, both nationally and here provincially, we're talking about what easing up on restrictions, public health measures would look like. And wanting to make sure that we also can measure the impacts of any of these easing up of the public health measures. We are looking ahead because I think it's important that we do that. I certainly feel like everybody else on P.E.I, it would be nice to know when exactly those public health measures would be restricted. The other provinces are also talking about what that could look like. Various stages, because the disease is and the virus is at different stages across the country. So it really was about in all senses. It's difficult to predict a date, but certainly we would like to look at what's happening here and knowing very much that if we can look at what's happening with the pandemic, look at what we know about the virus, and look at adherence to our public health measures, how that may impact us. Looking forward, of course, to easing up on some of the restrictions and what that might look like going forward.
Thank you. And a follow-up question. Is there a scenario, is there criteria for concluding that there is no community spread, and is there some possibility for easing restrictions here on P.E.I. within the context of maintaining tight border controls to sort of self-isolate collectively as an island community?
I think, Brian, those are the really key questions that we're trying to certainly think about and look at. What does that look like for Prince Edward Island at this point in time? Certainly the importation of cases from other provinces and outside the country remains a big concern. So how we do that and yet let confirm that there's no community transmission here, and how do we doing monitoring of that ongoing. These are certainly active discussions on a daily basis. So you're asking certainly the right questions, and we'll continue to have more discussion about that in the days and weeks ahead.
Brittany Spencer, CBC.
Hi, my question is for Dr. Morrison. Health Canada has approved its rapid COVID-19 blood test, and I'm wondering when we could have access to those tests here and how that would work for us here on P.E.I.
Yeah, so that's a particular sort of point of care testing that takes about 20 minutes. We actually have, with our local capacity testing, it's testing that's done within the hour, and now we're able to do so at Prince County Hospital and at the Queen Elizabeth Hospital. So in many ways, we have some good access to some fairly rapid testing here. So it is a discussion that we are having, and right now we have really good capacity at this time in Prince Edward Island in terms of our testing. So while we're watching that and are certainly aware of that particular rapid test, we are very fortunate that our tests are actually quite rapid here already.
And my next question involves people traveling to the island who are not essential workers. I'm wondering how many people have been turned away at the bridge, and for those people who are coming through the airport who are non-essential, is there a space or a room or something for them to ensure they self-isolate while they're at the airport?
Yeah, so again, two really key areas. So in terms of the restrictions for essential versus non-essential, we're actually having some discussions about how you try to be really a little tighter about those essential versus non-essential travelers here. And that involves, of course, many departments and aspects of government. And I think that discussion you'll probably hear more even as the week goes on about in that area. So more discussion for sure. It's we have certain healthcare workers that are coming across from our other provinces, and we know we need to have, for instance, some of those healthcare workers help us here. And yet we want to make sure that it is truly essential versus non-essential that are traveling here. And it speaks to that earlier question around the concern of bringing cases into Prince Edward Island. In terms of the airport, we have, with every week, fewer and fewer people arriving at our airport with fewer and fewer flights. And we have actually had some people who were continuing on to other flights, believe it or not, out of Charlottetown. They, because of flight scheduling, that were going to catch a flight many hours later in the day to Halifax, for instance. They were not allowed to leave the airport. They were put in a special area and food brought to them so that they isolated and didn't continue out of the province or continue out of the airport. And again, that discussion around essential versus non-essential, part of that process at the airport too. For us, we've always said really clearly that it is making sure that they have a very good self-isolation plan. So at this point in time, we are making sure that not only do they have a plan, but we actually know who is supporting them in that plan. So we're getting information about how they are going to get groceries. And then have the process where people are being contacted every day during that period of self-isolation. And we're asking them, are you able to get your groceries? Do you need supports? Who's helping you? And then there were a number of people apparently today that they weren't able to reach, so that will be referred on to enforcement if they weren't able to reach them as part of their self-isolation. So there's a number of things to help manage that at the airport, and having that discussion as we go forward with the Northumberland ferries and at the bridge. Not always easy answers, but something we continue to try to look at. And similar to the rest of the country, in certain places where they're really trying to have people who come in from outside the country have a self-isolation plan. We're doing that not just for people coming in from outside the country, but for anyone who's even coming in from outside the province.
Keith Doucette, Canadian Press.
Yes, good afternoon, Dr. Morrison. I'm wondering, given the situation that developed over the weekend in Quebec and Ontario in long-term care homes, whether that remains a concern for you in P.E.I. Despite the province's far lower numbers.
It absolutely, it is the area that I remain concerned about, because an outbreak in a long-term care facility with a number of deaths like we've seen in Ontario and Quebec, for instance, it would be so devastating. So it remains an area of concern. It's something that we're working with Health P.E.I. and not just long-term care and Health P.E.I., but also private long-term care. And the restriction on visitors, of course, being important, discussions about personal protective equipment, discussion around where possible, limiting the movement of staff, but still wanting to make sure people are cared for. So I think those are all parts of the discussions right across the country, but it is certainly, it remains a concern, and that would change our numbers here so quickly.
Yeah, and a follow-up. In terms of the workers who work at multiple homes, what's the situation on P.E.I.? Is it typical of other provinces? And is that something you're really honing in on to try to perhaps curb if you can?
I think we are trying to look at exactly how you said, wherever possible, and putting together the numbers of people who actually do move from facility to facility, and having that discussion with the Health P.E.I., for instance, and outside the system in the days ahead about what that might mean and what that could mean for the system. So I think it's a discussion certainly that we want to have, balancing that need for the care by our providers, but also the concern that may, with people moving too much between homes.
Steve Bruns, Guardian.
It's actually Stu here from The Guardian. Question for Dr. Morrison. Again, talking about the Spartan Bioscience portable rapid testing device. Just wanted to know, is the CPHO or any other provincial agency in talks with Spartan Bioscience about any purchase or anything at all, or have there been no talks at all?
Well, as far as certainly from our office, we haven't had conversations with them, but we have reviewed their, I'm sure you have some of the submission and approval through Health Canada for their product. We will continue to again, look at it as an option, but we have been in a situation where we've already ordered in. We've talked here before, Stu, about another machine coming in here that's part of our local capacity building that actually has a very quick turnaround ability here. So it'll be different for different provinces who may have a need for a different capacity at this point in time, but we'll continue to monitor it.
Okay, and just as a follow-up, I wonder if you could provide, I guess, details of the manufacturer names of those machines, like the testing kits that P.E.I. is currently using. I gather there's more than one manufacturer we're using.
So, Stu, I think I'll be pleased to provide. I could give you the names of what I call them, but I think for simplicity's sake, just to make sure I'm even have the whole name, complete name, we can provide that to you in writing.
Okay, thanks very much.
Laurent Egol, La Voix Acadien.
Oui, bonjour, Dr Morrison. Au début de votre message, vous avez parlé de la situation au Canada en donnant les chiffres du nombre de malades, du nombre de morts. Est-ce que l'épidémie au Canada, elle accélère ou est-ce qu'elle ralentit aujourd'hui?
Alors, je pense que peut-être une indication qu'il y a un peu de bonnes nouvelles, que les cas au Canada doublaient chaque 3 à 5 jours. Mais depuis les 10 derniers jours, ça double, ou 2 semaines, ça double maintenant 5 à 8 jours. Alors, peut-être une indication dans le pays que ça juste réduit le montant de cas. Alors, je pense que c'est une bonne chose. Juste que ça donne une indication que ça ralentit peut-être un peu, mais c'est seulement depuis les 2 dernières semaines.
Et les autorités fédérales ont publié un document de prévision d'épidémie pour faire des estimations de comment elle va évoluer. Est-ce que ces estimations, elles existent à l'échelle de l'île du Prince-Édouard?
Okay, je ne sais pas si j'ai compris, mais si les estimations de qu'est-ce qui arrive, c'est la même sorte de chose ici à l'île du Prince-Édouard? Est-ce que c'est ça?
Si le Canada a publié une modélisation
oui, okay.
sur comment l'épidémie pourrait évoluer dans le futur. Est-ce qu'il y a la même chose à l'île du Prince-Édouard?
Oui. Alors, les modèles, on en parle, c'est difficile d'avoir les modèles des autres provinces et du Canada si ça fonctionne ici parce qu'on n'a pas, on a un nombre, la population est assez petite, puis on n'a pas de morts, on n'a pas d'hospitalisation ici, mais alors ça va être un peu différent ici qu'au pays en général. Et on est en train quand on regarde les territoires, c'est peut-être, on est un peu plutôt un peu comme les territoires, mais on est en train de regarder les modèles ici et si ça va marcher pour les parler publiquement.
Merci.
So the first question was that I was to translate was around is there any indication that there's a slowing of the rate of cases in the country? So until in the last number of days, the rate of doubling, which was every 3 to 5 days for the country, is now looking like it's every 5 to 8 days in the last couple of weeks. So that may be an early indication that the virus may be slowing down in terms of the increase in cases across the country, but I think it is still pretty early to make any big prediction. And the next question was, do the Canadian models of what's going to happen in terms of the virus, can we apply them here? And I think there are challenges with applying those models to P.E.I. in the sense that we have a very small population relative to many of the other provinces. We do not have the hospitalizations or deaths on which to base some of the modeling that they've done other places. We continue to look at those models, have discussions about what they look like or what they can and cannot do here in Prince Edward Island, and we may be more in line with some of what the territories may look like, but ongoing discussion there.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Je me demande, dans la mesure où on a peu de cas ici à l'île, il y a la plupart des gens qui ont attrapé le virus sont maintenant rétablis. Il n'y a pas de transmission communautaire. Est-ce qu'on peut envisager un relâchement des règles à l'échelle provinciale tout en maintenant les frontières fermées avec les autres provinces? Mais est-ce qu'on peut quand même envisager peut-être plus rapidement de rouvrir des magasins, de rouvrir des services à l'île tout en maintenant les frontières fermées?
La réponse est, j'espère que oui. Je peux envisager cette sorte de relâchement des mesures, mais de contrôler le pont et le traversier et l'aéroport. Je pense que c'est trop tôt de donner les dates ou de confirmer ça, mais je sais que qu'est-ce qu'on fait maintenant, ça va nous donner plus de chances d'en faire, de faire un relâchement dans les semaines qui suivent.
Une petite précision aussi, si je peux me permettre, Dr. Morrison. Vous avez mentionné 4 charges, donc 4 infractions au cours de... Est-ce que ça, c'est au cours de la fin de semaine ou si c'est depuis le début de la pandémie qu'il y a eu des amendes qui ont été données à des insulaires qui ne respectaient pas vos directives?
Le 4, et je pense que j'ai dit 4, mais je pense qu'il y en a vraiment 5 depuis hier soir. Mais c'est depuis l'ordre du santé publique, alors il y a 2 semaines, je pense.
Parfait. Merci.
Okay, thank you very much.